Next, when Lewis Hornby noticed that his grandma, 82-year-old Pat, who has dementia, wasn't drinking enough water, he decided to do something to help. He knew that dehydration was a serious problem for patients with dementia. So 24-year-old Lewis invented these brightly coloured sweets. They're called jelly drops. They are said to be easier to swallow than water, and they're very hydrating. Lewis is here, as is Dr. Mina Bobdey, consultant psychiatrist who works with older adults and specialises in dementia, and in Salford, Tony Watson, whose wife Joy was diagnosed with early onset dementia in 2013. Tony, good morning, and welcome to you in the studio as well. Lewis, hello.
Hi. Good morning. Hi.
So, tell us how this came about.
Well, I studied a course called Innovation Design Engineering at the RSA in Imperial, and as part of that we have 5 months to do a project on whatever we want to. So about a year ago my grandma became severely dehydrated and was rushed to hospital. The doctors were pretty much like expect the worst basically, but after 24 hours of being on a drip she was absolutely fine, and fortunately is still enjoying a good quality of life to this day. So I thought, you know, dehydration amongst people with dementia is a big problem. Researched into it a bit more, realised it was affecting more than just my grandma, so I thought I'd make my project about trying to tackle that.
And it works?
Yes, well...
Does your gran like them?
Yeah, well, I mean, she can't really communicate that she likes them, but, you know, she eats them, so it's a good sign.
Well, I thought in the first 10 minutes when you took them to her, she ate 7.
Yeah, and that's the equivalent of drinking like a glass of water.
Is it really?
So, I mean, I guess a problem with working in this area is it's really hard to get permission to work with people with dementia. They don't have power of attorney over themselves, most of them. So it was a good opportunity to work with grandma, see a bit more of her, but also, you know, they couldn't stop me going in the care home, so yeah, I could do a lot more testing than I would have been able to do otherwise.
Understood. Tony, hello. Welcome to the programme. Thank you for talking to us.
Oh, good morning.
Is it difficult to keep Joy hydrated?
Well, because Joy is still in the early stages of her dementia, she still enjoys a drink and will drink, although often when I make her a cup of coffee or a cup of tea or a juice drink, she'll forget it's there. But I believe that as the disease progresses, and fortunately Joy's disease is progressing very slowly, but as the disease progresses, I believe that she will forget to drink, as many of our friends do. And this, I think, is a tremendous way of encouraging people to drink, sometimes really without realising it, but a sweet or something of that nature is much easier for them to visually see, pick up and just pop into their mouth. And it's a wonderful thing. I think this guy's brilliant. It's a marvellous invention.
How do you react to that, Lewis?
Well, thanks very much. I mean, it's great to hear that the validation from other people that are in a similar scenario to my grandma, and since I've been getting a bit of media about it, I've started a Facebook group, and there's, you know, tens of thousands of comments of people in a similar position commenting the same thing, and people that said they've worked in care for 30 years and they think this might do the trick. So yeah, and yeah.
Might it do the trick?
Yes, I think so. Dehydration is one of the biggest problems, and as Tony said, and as you said as well, when people get dehydrated, it causes they're not drinking enough.
Yeah.
When they're not drinking enough,
just to be really basic, it's because people with dementia forget to drink.
they forget to drink,
Right.
and they forget they're thirsty. The centers in the brain which tells us we are thirsty may get affected depending on which part of the brain is affected in dementia. So it's so important. If they don't drink enough, they're prone to get infection. They're prone to get more confused, a thing we call delirium on dementia. So they can get acute confusion on the chronic confusion. In delirium, people can present with behavioral problems, which can increase the carer stress, and that can lead them to go into a placement or get admitted into hospital. So drinking enough fluids is a secondary prevention for complications of dementia. So it's very, very vital. So I think it's a brilliant invention to get people to drink more. The additional thing is, when you are getting dementia and when the cognitive impairment increases, people go back to their childhood and they become like child. And the sweets is something which we all associate with our childhood. So if old people can have more sweets, which has got more fluids, which is going to be easier because they're going to relate to it as a childhood thing, they're going to drink more. So I think it's a brilliant invention. So drinking enough fluids is really very important to prevent infection, prevent other complication.
Okay. It's not available yet. I was really disappointed that you weren't able to bring them in, because I was dying to try one just to see what the taste was like.
Yeah,
but I mean, they taste like sweets, do they?
Yeah, they're sweet, and they don't necessarily have to be a high sugar content. I'm looking with a food innovations lab to make them as suitable for as many people as possible. So, you know, vegan versions suitable for diabetics. But yeah, at the moment, it takes me quite a long time to make just a small amount. I'm not even able to supply my grandma with a constant spice. But you know, with the support I've had so far, and I'm sort of trying to build a team around me to hopefully ramp up production and hopefully do further trials and get it on the market as soon as possible.
And how is Joy, Tony?
She's doing very well at the moment. She's had health problems because she had a serious hip complaint. So she's now recovering from a hip replacement. But she's keeping busy, still doing speaking engagements. In fact, she's at the Young Onset Dementia Conference in Birmingham today, and still trying to live life to the full and doing very well at it.
How long then before they'll be out there, do you think, Lewis?
Well,
hopefully?
I'm hoping early next year, a few months, maybe a bit longer. That's the plan at the moment, and yeah, hopefully that's realistic.
And how is your relationship with your grandma?
Grandma's doing great, yeah. I mean, I still don't get to see her as much as I probably would like to do. She's up in Yorkshire, which is one of the reasons why I did the project, so I could see a bit more of her. But yeah, no, obviously it's great, and she still recognises me. I mean, we can't really have like a conversation and stuff, but you know, she appreciates it when a family visits, so it's nice to go and see her.
Could be a game changer, couldn't it?
It would be. If I can add, like dehydration and hydration is such an important thing. And as a part of prevention, which I said, along with hydration, I tell all my patients, so think of those 5 things. Hydration is very important. So is nutrition, prevention of constipation, pain management, and management of infection. If you take care of those 5 things, there are chances of preventing admissions to the acute hospitals, there are chances of reducing the carer's stress, and there are chances of improving the quality of life for our people who are suffering from dementia.
Okay.
So it's very, very important. Hydration is very important, very vital.
Thank you. Thank you very much, all of you. Thank you so much for coming on the programme. Thank you, Tony.
Thank
Appreciate
you.
your time. And our best to Joy. And good luck, Lewis.
Thank you.
Let's sooner the better from the sounds of things. Thank you so much.
Thank you.